Hello, and welcome back to the Trestlebridge Capital Expert Network Spotlight Series. Before we jump into today's discussion, here's a quick message from our legal team. Joining us today is Medicare expert and founder of Next Stage Benefits, Ted Wallace, alongside our managing partner, Eric Jefferson. Let's get started.
Welcome to the Trestlebridge Capital Expert Network Spotlight Series. I have a great guest joining us today, Ted Wallace, founder of Next Stage Benefits. He's here to help us unpack everything you ever wanted to know about Medicare insurance. So, Ted, greatly appreciate you giving the opportunity to join us here.
Eric, I really appreciate the opportunity to be here. I'm excited to help educate people on Medicare insurance planning. Thank you for having me on.
And when you think about that topic, I know it can be very intimidating for a lot of people. Our goal for today, cover the different pieces at a very high level, talk through some of the considerations that folks should emphasize or at least have on their radar. And then lastly, if we do have some time, we can touch on some of those regulatory changes that are impacting potential decisions based on new legislation and guidelines going forward. But before we dive in, I know this is a topic you're incredibly passionate about. What drove that passion, and ultimately, how did that get you to where you are today?
I have to be honest, I never thought that I would get as passionate and geek out about Medicare as I do. As a client told me one day, I'm glad this is your passion project because it certainly isn't mine. Really, I saw my own parents go through this process, Eric, and they were inundated with junk mail, and I knew there had to be a better way. I finally took the plunge years ago and left corporate and started Next Stage Benefits. And what's neat or what's a unique position is I'm able to represent multiple carriers, to be able to present multiple plans to clients and really compare and contrast some of the benefits, some of the costs, and help them make a decision. And I really work for the insured at the end of the day, not the insurance company. So that's why I thought that independent broker position was so appealing and would really resonate with folks.
Absolutely. And one piece, something from our initial conversation that stuck out to me was your compensation is not tied to any sort of sale. And I think that's a really important point to clarify. If you're looking for insurance, there's no difference in cost whether they go directly to the carrier or they work with a broker like yourself. The difference is they obviously have an advocate in their corner. I think we probably call that a win for everybody.
Yeah, that's exactly right. Looking at getting into this, I said to myself, that's really neat. I get to work with folks. They pay the same costs for their insurance, whether they go directly through the carrier or they work through me. And at the end of the day, I provide my services complimentary to people. We follow a really transparent process where everybody we speak to sees both a Medicare supplement offering and their associated costs and the pros and cons to those plans, and also a Medicare Advantage plan. So we really want people to just feel educated and empowered because ultimately this is the decision around their health insurance, likely for the rest of their life. So we want to make sure people feel good about it.
Absolutely. And before we go there, for folks that maybe aren't as familiar, we think about the different components, the different segments of Medicare insurance. Walk us through at a high level what those are and maybe touch on what they do and potentially even don't cover.
Most definitely. So original Medicare, you'll hear that term, or beneficiaries will hear that term a lot. And what that means is Part A and Part B. In very broad strokes, Part A is going to represent your hospitalization billing and services. And what I tell people to think about is when you're sleeping overnight at the hospital, generally those are the services that get associated under Part A. And if you've been working for 40 quarters and paying into the system, that is premium free. The other part of original Medicare B is related to what they call doctor services. That's going to come with a monthly premium that gets paid to the federal government, to Social Security. With that on Part B, when you pay your premium, if and when you use those services, you have a yearly $257 deductible, and that will help cover 80% of the costs associated with things like outpatient surgery, going to see your PCP, if you need to go into the ER. I think folks get the idea. And what isn't covered is the 20% out of that 100%. So Medicare will cover 80. The other 20 If you don't have something to help protect you, that's on the beneficiary, and there's no limit to that. So this is original Medicare. The two other parts you'll hear about are Part C, which is synonymous with Medicare Advantage. Part D are your prescription drugs. That would need to be purchased as a standalone Part D plan, and that is a government enacted plan that is serviced through private insurance companies. Or if you chose the Medicare Advantage route, you would have your Part D as part of your Medicare Advantage plan.
Perfect. As we think then about what your options are, I know that's where you probably spend a majority of your time, separate from educating, but helping folks understand based upon your circumstances, what's unique to you with your healthcare, with your costs and your outlook. What are the best options based upon what you're looking to spend? Talk to us a little bit about what that entails.
Exactly. So when I'm speaking to folks about what their options are, we have original Medicare, and we talked a little bit about what that covers, but as somebody who wants to educate people on the gaps in the risks that are not covered, that's going to give us an understanding of why we need the products that are available, which would be either a Medicare supplement or a Medicare Advantage plan. So for Part A, in this diagram, we talk about in 2025, how many hospitals days may have coverage, what co-payments look like after certain number of days in stays. And then also, there is a lifetime limit on these 60 non-renewable days. And once you are through that benefit, you wind up assuming all costs on Part A. So what we want to talk to people about is how do we help protect against those gaps in the original Part A? And then on the Part B side of the house, we want to talk about that 20% that is on you, the beneficiary, with no out-of-pocket maximum. You may not be expecting an issue to come up as it relates to your health care, and there is no planning for these unexpected pieces. But when they do come up, the last thing you're going to want to be worried about is the coverage that you have, because you're just laser focused on your health and getting the outcome that you so critically need in that kind of circumstance. It is a good idea to consider these other products that we'll get into in just a moment. Now, the other thing with original Medicare, I spoke to it a little bit, is there's no Part D or prescription drug benefit. So you're going to want to look at a prescription drug plan that's going to cover that. I have a lot of folks that come to me and say, hey, Ted, I don't have any prescriptions, or I have one prescription. The tricky thing about that is you still need to pick up coverage, because if you don't have a Part D plan, there are penalties associated with not carrying one that will be attached to your premium from the federal government in the future. So we want to make sure that we cover off on that and have that conversation. Because if you ever need to use a prescription drug in the future, then when you sign up for that Part D, those penalties will come into effect.
Great.
Now, I talked about how do you cover those gaps. People are going to get a ton of information just like my parents did. They're going to be inundated with this stuff. At the end of the day, there's two products you can get to work with original Medicare or to cover your gaps by assuming the services of original Medicare. And that is a Medicare supplement, which is also known as a Medigap plan. And what that does is, much like the name, it supplements the gaps in original Medicare to help cover your exposure. And in many states, those follow an alphabetical naming convention to the plans. The other really interesting piece about supplements is there's no formal prior authorization mechanism. So if it's a procedure in there and your doctor and you deem it medically necessary, then you can go ahead and get that procedure. So those are some of the things that people find very beneficial on the supplement side. Generally, what we see is there is a cost associated to that. So your premium on the supplement side is going to be significantly more than on the Medicare Advantage side of the house. Your supplement is going to work with Original Medicare. So when you go to your doctor, you hold on to your Original Medicare card, the red, white, and blue card, and you have your supplement card. When things get billed, the billing company actually bills Medicare, and then Medicare is going to send the balance out to your insurance company. So a little bit more management and organization on the beneficiary side with the different plans, but there's a lot of benefit to them as well.
That's great. And on our next slide, talk about different ways to affiliate. And one of the things you do, we'll look at breaking down the expected or anticipated future costs, trying to navigate, understand which option potentially makes the most sense. At a high level, what does that look like?
Exactly. You have your supplement side, and then we look at the Medicare Advantage side. And like you were saying, this goes back to a very transparent process. So on the Advantage side, you have a lower premium. Generally, you're going to see a zero premium. There's a couple that are getting introduced in the current Medicare landscape because of the macroeconomics of how this is all coming together. A lot of times your PCP will be a zero copay to see your PCP. They'll have some dental, vision, and hearing sprinkled in there as well. But in broad strokes, when we see the Medicare Advantage plan, they're going to tie all these things together. They're basically telling the government they're going to assume A and B, and they're going to manage your care. And the reason why these premiums can be low is because they're subsidized by the federal government to take over that care, to provide these plans. And these plans are regulated by the CMS, the Center for Medicare Services. And what they like to do is wrap in some of these things, like make it a little bit easier, a little dental, a little vision, maybe a little hearing. And the difference here is you'll have a little bit more of participation as it relates to if there's a copay that has to be paid for a hospitalization or for a day surgery. And then what blankets this all is a max out of pocket. So from an insurance risk standpoint, it's great to have something like this in place because like we looked at with original Medicare, some of that 20% has no limit. So there's a max out of pocket that kind of blankets this so that you're not going to have a $100,000 medical bill. So moving on from the supplement in the Advantage plan, people say, Ted, what else do I have to think of outside of cost? So what we usually do is we'll put quotes together. We use a few different tools. Sometimes we're right on Medicare.gov. It's a great tool for people and a great resource. But one thing that people don't factor in, and why I love working with you, Eric, is people aren't thinking about their income-related monthly adjustment amount. And this is for your Part B that gets paid directly to the federal government. Essentially, it's a surcharge. Depending on your joint tax return, or if you're an individual, your individual tax return, the way it works is it's almost like your taxes. If you earn a little bit more, you're going to pay a little bit more. So there's a surcharge on your Part B, and that is calculated against your modified adjusted gross income from 2 years prior. So what we can do is usually we talk and say, hey, I know things have come up where people might move an IRA and they want to take it out, they want to move it into a Roth IRA. If that's going to inflate your taxes to a certain amount, let's try to plan for that so that we don't go over by $5 and knock into the next bracket so that we have even more of a surcharge on our Part B. And then generally, a lot of people don't even know about this, Eric. So helping them understand that as they're planning for retirement, there is this other thing called IRMAA, and we should be mindful of it.
One of the many things you could do, you think about the different components and different levers, helping somebody not only navigate to the right coverage, but pay the right price for it.
100%. We talked about a couple of different components. And one of the things I like to emphasize and stress is when you're looking at what you're going to do for your health care with Medicare insurance planning, the point of this slide is someone should show you a comparison that shows you what a supplement looks like and what the associated costs are estimated monthly. We show everybody both solutions and help them make the decision because ultimately it's up to that beneficiary which choice to make. And we just try to educate them, much like you do your clients, around their financial decisions, around, hey, this is what's available to you for your insurance. These are the benefits. These are where some pros are. These are where some cons are. How do we make an educated decision together? So that's a main point here.
Absolutely. And for folks that are maybe years out from retirement and enrollment, obviously, depending upon circumstances, can one plan make more sense than the other? But generally speaking, what's that ballpark figure you would encourage clients or even advisors to forecast for annual expenses once they do officially retire and opt in for Medicare insurance? And I know that's a tough question, but if
Yeah,
it was
it's
a ballpark sense.
it can be a tricky one. I would say ballpark for covering your insurance plan up to 6,000 a year. I have some folks that are in the top IRMAA bracket. So for their healthcare, they're into it for maybe $7,000, $8,000 a year, but around there, and things can get super affordable too. You can get a really affordable Medicare Advantage plan, and if you're under the initial tax bracket, people are into it for $2,000, $3,000 a year. Now, that's also primarily when I'm working in Massachusetts. The prices do vary based on state, based on county, but that's a lot of what I see. I usually try to tell people, let's plan for a little bit more. And if you don't need it, it's always good to need a little bit less than you expected rather than trying to find more than what you planned for. So I generally tell people to plan a little bit on the higher side. And if we come out lower, then that's good news for everybody.
No, absolutely. And I know we had talked about each year from the regulatory environment, those circumstances can change. And something folks may even be receiving today is notification of annual changes. Somebody does receive something in the mail. Walk us through quickly, if you would, at a high level, what that means and what are their options.
We have a slide on that as well. This is currently what is going out to people. And my main message to people is if you have an annual notice of change, hold on to it. If you are in a Part D prescription drug plan, or if you are in a Medicare Advantage plan, the insurance carrier is required by law to let you know about any changes upcoming in the next plan year. They are going to have a page in there that will say where your highlighted changes are to pay attention to within that document. Some of them are 30, 40 pages long. But look at that highlighted page. If you don't like what, speak to somebody like an independent broker like myself. They can compare multiple plans. I have groups that I belong to. We've been studying this stuff. We've been looking at plans since October 1st. We got some first looks a little bit prior. So we're well educated around where to transition to and how these plans all compare. So out of all the junk mail, hold on to that one. It's super important.
Greatly appreciate you first sharing some high level insights as well. More than willing to work with anybody that's looking for some perspective, ensuring they're on the right track. We'll have your contact info up at the end. But again, want to thank you for joining us. Know this is a very busy time for you. So appreciate you carving out a few minutes for us.
It's my pleasure.